Dr. William Schweitzer and his patient, Amy, they join us. So it's just been a few days since Amy had the procedure. I want to see her results. How about the rest of you? Yeah. So let's start with Amy. So, Amy?
Yes.
Is that you?
I just said, wow. It was the best decision I've ever made for myself. So it's amazing. It was an instant lift, and it just automatically just smoothed out the crinkly, kind of saggy skin, and it was instant. It looks amazing, and I'm so excited.
Well, yeah. I mean, you do see it in the photos, and Dr. Schweitzer, clearly, Amy was a great candidate for this. But in this case, you are relying on those sutures. You're pulling everything up, which is different than a tummy tuck, because tummy tuck, we're pulling everything down. So that part of it, I like. I just wonder, you are using PDS, these are dissolvable stitches. I just wonder if in time, what's gonna happen?
That's a great question. As you know, PDO material as sutures has been around for many, many years for internal surgeries. Very good safety profile. Longevity should be about 12 months, possibly up to 15 months or so. And as the threads dissolve, as they do, the increased collagen you built to support them stays in place. So that keeps the lift going. Eventually, the collagen will recede, and then we just put some more threads in, and she maintains the result.
The cool part that you did create a scaffolding. You weren't just going vertically, but you also passed horizontally.
Yes.
Creating sort of a mesh. Dr. B, what do you think?
So I thought this was a really interesting application of this thread lift, especially like he's saying that mesh foundation is going to really stimulate a lot of collagen. I guess my question for you is, what are the risks for our viewers if they're considering something like this?
Whoever you see has to be very highly trained in this. It has to be performed in a very clean environment to lower the risk of infection. And common minor complications we see are temporary bruising, maybe slight puckering or irregularities in the skin, but they usually clear in about 2 weeks.
And how often do you see one of those threads just lose its tension and give way where one kind of fails?
The threads we use generally don't. There's a brand new thread that came out just a few months ago called an 18-gauge barb 4. They have much greater longevity than the threads that we would typically use on the face, and much more holding power.
And how much would a procedure like this cost, Dr. Schweitzer?
You know, these are not the threads your tailor uses to hem your pants.
Sure, understood.
These are a very specialized thread. Depending on the number of threads you use and the complexity of the procedure, it could be about $1,800 to $2,500.
Okay, well, you know, looking at a full abdominoplasty, that's a pretty reasonable deal. And as you said, you know, you do this procedure, skilled hands, other experts, surgeons, dermatologists that understand the anatomy of the skin, because you are placing this in the skin is key, because you have abdominal structures deep to you. You don't want to go walking into a medi-spa and have somebody doing this who doesn't get the anatomy. I do have to say, Amy was the ideal patient for this. Such great skin tone, no fat, loose skin that really responded well to an upward pull. Those are pretty impressive results.
I think those are impressive results, and just goes to the importance of getting this done sterilely and in trained hands.
Yes.
But really a nice addition to the armamentarium for this kind of issue.
Well, Doc and Amy, good stuff. Good luck to you.